Good morning, my dears. Today I'm going to give a topic or talk about something topic called genetic counseling in retinoblastomas. Retinoblastoma is the most common primary intraocular tumor in children. Never forget this point. Definitely they will get this. All the exam postgraduate students definitely will get this type of patients in the exam hall. You will be asked some questions regarding the genetic counseling also. This retinoblastoma is compared to be what is called a forget-me-not, these flowers. There's a story is there when a knight picked up a bunch of flowers for his beloved, but he fell into the water and sank instantly because of the weight of his armor. Before he got drowned, he quickly threw the flowers to his maiden and shouted, "Forget me not." That's the way the flower got the name Forget me not. But here is not is concerned with why retinoblastoma is compared now. The forget me not, these flowers grow in a shady areas, the banks of a river, something like that. Whereas here also retinoblastoma supposed to grow under shady areas in the retina. That is why it's called forget me not. Now genetic counseling. Please remember, you know one thing we have got, Knutson's hypothesis. Knutson's hypothesis called, that is called Knudsen hypothesis. What is that? Knudsen hypothesis means, I'll tell you one important point. Imagine now we have got a sperm. We have got a sperm. Oh, wow. Sperm and ova is there. By chance, sperm or ova got mutated before fertilization. That means what now? The cells have got, it's called germinal mutations. It's called germinal mutation. Now these mutated cells now combine, ova and sperm, they combine. That called fertilization has taken place. Now, after fertilization, it's called the first hit. The first mutation is called first hit. After mutation, what happens now? We have got so many cells now. Please remember now, a genetic mutation means what? The mutated cell is there, which can, after fertilization, they can go to everywhere in the body, in almost all the cells. Retina, bone, everywhere they can go. That's why a second mutation, if it occurs in the retina, retinoblastoma occurs. That means what? A first mutation occurs before fertilization. It's called genetic problem, genetic mutations. That means coming in families like this. Hereditary parts called hereditary patterns. That is called hereditary pattern. When a patient has got hereditary pattern is there, the fellow has got second mutation occurring in the retina, he will develop retinoblastomas. But remember now, this patient will have already mutated cells everywhere in the body. That is why the chance of developing a second malignancy, for example, in the bones, osteogenesis sarcoma is very common. That is why we can have second tumors. Apart from retinoblastoma, they can develop tumors everywhere in the body. That's the reason of one thing. When you have a patient whom you have diagnosed have hereditary pattern of involvement, retinoblastoma, you are supposed to give treatment to the eye as well as advise the patient to be followed throughout his life, because the chance of developing second malignancy is more. Whereas by chance, the sperm over normal, no mutation, now fertilized, the first hit or the first mutation, they're somatic now. It occurs in the somatic mutation. It occurs in the retina. Second mutation occurring in the retina, it develops retinoblastomas. Where the chance of developing second malignancy is very rare in this patient. The chance of developing second malignancy is very rare in this patient. That is why if you treat the patient of non-hereditary pattern retinoblastomas, you can treat him, you can follow him up to maximum of 6 years of age, after which recurrence is impossible. After which recurrence is not possible. That is why you are supposed to follow the person up to 6 years of age. That is a non-hereditary pattern of retinoblastoma patients. You are given treatment, he has improved. You follow the person till 6 years of age, every 4 months or something like that. You can follow, then you can advise him. That's all. You can need not follow further. Whereas, never forget again, hereditary pattern fellow, as child, you are given treatment, patient has improved, but follow him throughout his life. That's the most important point, because hereditary pattern fellows can develop second malignancies very easily because he has got mutated cells everywhere in the body. He has got a mutated cell everywhere in the body. Now, what is the type of inheritance, if at all? It is called autosomal dominant. Autosomal dominant. But never forget. Everyone knows autosomal dominant means a 50% chance is there for the child to get problem. That is what everyone knows. The autosomal dominant inheritance means what? A father or mother, anyone got affected, that fellow person can transfer the disease. The chance of developing problem is 50%. Whereas in retinoblastoma, it is incomplete penetrance. What is incomplete penetrance means? What? There's a chance is there, but hardly 40 to 45% chance for the child. It is not exactly 50% chance or 100% like that. So definitely the child may develop, but the chance is less, 45% chance. Whereas dominant without full with full penetration, 50% chance is there for the child. Retinoblastoma is one thing, dominantly inherited, autosomal dominantly inherited, is an incomplete penetrance. Never forget this, incomplete penetrance. Now, what is the cell? Which is the gene affected here? The gene is called RB1. That's called retinoblastoma gene. This gene is a tumor suppressor gene. The gene is a tumor suppressor gene present in all of us. Whereas, which chromosome? 13th chromosome, long arm. 13q, long arm of the 13th chromosome, 1,4 location. It's normally there. If it is deleted or inactivated, the problem starts for the child. So the retinoblastoma gene normally present in 13q14, if deleted or inactivated, the problem can start for the child. The child can develop a retinoblastomas. This what autosomal dominantly inherited. One thing, suppose I'm having 100 patients. Only if you can have a problem of dominant, this inheritance hereditary pattern will be only 40%. The remaining 60% is sporadic only. Is non-hereditary patterns. Non-hereditary patterns usually. Majority of the retinoblastomas coming under non-hereditary patterns only, non-hereditary. Whereas only 40% chance is there, 40% is there, hereditary patterns. Now you see, I already told you, the mutation occur where any one gene, I told you. Germline cells, that is before fertilization. After fertilization, there are 2 hits. These 2 hits depends upon the problems now, the developing retinoblastoma, which is hereditary and non-hereditary, that's all. Now, I'll tell you. Sometimes I can have retinoblastoma is there right eye. Retinoblastoma is there in the left eye. He's having a pineal body tumor also. That is called trilateral retinoblastomas. You know why? Retina is neural ectodermal structure, neural ectoderm. Pineal body also neural ectodermal structures, so they can get involved easily. That is why if a patient has got a right eye, left eye retinoblastomas, along with the pineal body tumor is there, and he can have what is called trilateral. Sometimes you can have quadrilateral. What do you mean by quadrilateral? They will ask you in exams. Your answer is, sir, right eye, left eye, pineal body. Pineal body is supposed to be called as our third eye. Pineal body is supposed to be called as our third eye. Then we can have parachiasmatic areas. If a tumor is there, you call it as quadrilateral retinoblastomas. Never forget. These are all some of the terminologies that can be asked in exams. Now we see, how do you know? See now, I told you sperm or ova mutated before fertilization. I know that. That's what I told, hereditary pattern coming from father, mother. Anyone from either from mother, father, or mother. That problem is coming. Mutated cell is coming. But the problem is what now? How do you know? Clinically, how do you know it is hereditary? Then only can I give proper advice. Clinical, how do you know? It is non-hereditary. Very simple, I tell you. You examine the child. Complete examination, fully dilated fundus. You have to examine. When I see unilateral solitary, tumor, when you see unilateral solitary tumor, it is non-hereditary. That's the only thing, man, non-hereditary. That's the only thing. Remaining, suppose I'm having unilateral multiple tumors like this. Unilateral multiple, you never forget now, never. One point I'll tell you. One tumor is there, second tumor, third tumor. These are all individual tumors. It's not spread. Because retinoblastoma is the only tumor which can have what is called a multicentric origin. One tumor has got 10 tumors, means all are individual tumors. They are not spread. When you have unilateral multiple tumors, it is hereditary pattern. It is hereditary. Suppose I'm having bilateral. Both the tumors are there. It is definitely hereditary patterns. So only one thing is there: unilateral, solitary, non-hereditary. Unilateral, multiple, hereditary. Bilateral, always hereditary. Trilateral, always hereditary. Never forget. Is the most important thing. That's why I told you. Hereditary pattern is there. I know hereditary pattern. The chance of transmission is about 45% chance. If a non-hereditary pattern is there, the chance of transmitting that to that patient's children is about, less only. Already follow. This is what genetic counseling. Before that, you should know whether it's a hereditary pattern or non-hereditary pattern. Then only you can tell about the genetic counseling to the patient. Now, I'll tell you one example. Here. Genetic counseling. You see now, the father is normal. These are all already calculated. Now, mother is normal. That means what? They are going to have a child. The child, unilateral solitary. Unilateral solitary is there. That means what? This child is a non-hereditary pattern. There is no mutation before fertilization. Both the mutations occurring after fertilization, both the mutations occurring in the retina after fertilization only. That is non-hereditary. Non-hereditary. Imagine now, this child is become non-hereditary pattern of child. Problem. But father normal, mother normal. The child has got non-hereditary patterns. Now the father is asking, can I have one more child? What the chance of developing a retinoblastoma in that child? What's the chance for the next child to give? Is this fellow child siblings? What's the chance? Your answer is, sir, father normal, sir, mother normal, sir. A child is also a non-hereditary pattern, sir. The chance of developing second child for the father or mother, this is called less than 1%. Only 1% chance for the child to get involved, for the next child to get involved. Please never forget this. This is based on father normal, mother normal, child is non-hereditary patterns. Imagine now the same thing. Father normal, mother normal, child, multiple unilateral, bilateral hereditary patterns. Hereditary pattern is there. That means what? The father is asking, father is normal, mother is normal, child is having hereditary patterns. The hereditary pattern retinoblastoma is there. Now what will happen now? He will have, father is asking, can I ever one more child? Your answer is, your chance of giving birth or something, mother, the next child chances are approximately 6 or 8%. Never forget. Just tell all these numbers. That's enough. Don't get confused. Here, what case now? Case scenario is what? Father normal, mother normal. Child non-hereditary pattern. Next child chance 1% or less. Child hereditary pattern, bilateral, unilateral, multiple. Chance of the next child is what? 6 or 8%. Never forget this point. Now the next question comes. Doctor, imagine now this child, unilateral solitary child, non-hereditary pattern child. You are given treatment. You have given treatment to the child. The child is only 1 or 2 years old. That you are given treatment to the child. The child becomes 25 years old. That means child has improved. The tumor has been cured. Now the child is becoming 25 years old. Now he wants to marry. He has come to you. Can I marry? He's asking some questions. You must give him counseling now. Hey, your answer is non-hereditary pattern. That means you have come unilateral solitary pain. That's a non-hereditary pattern is there. Your chance of giving to your children is about 6 or 8% only. This is because you are a non-hereditary pattern. You are a patient of non-hereditary nature. So your chance of giving your children, chances are what? Only 6 or 8% only. By chance, this fellow comes to you. Unilateral, multiple, bilateral is hereditary pattern. Is a hereditary pattern of child. That means what? He, when he becomes normal, we have given cure, he has become normal. You have cured him. Now the fellow asks for marriage and can I get a child? He's asking you. Your answer is, sir, it's a hereditary pattern. It's a hereditary pattern of inheritance. The chance of transmission to his children is 45% chance. I told you, it's an autosomal dominant within complete penetrance. That is why hereditary pattern child, this fellow child, he has given treatment, he has become normal. Now he has become 25 years old. He's asking for marriage. Now after marriage, what will happen now? You tell now your chance of giving a child is what? Your child may be having a chance of 45% chance. 45% chance is there. That means what? You can't say you cannot marry. Please remember that. You can't say you cannot marry. If at all you want to, you have to give him instructions. You can marry. Because here, suppose hereditary pattern child is there. It's like this. Hereditary pattern child is there. If you marry, if by chance you get a child, better get him examine frequently. It's the most important point. You have to examine the child. Important examination has to be done every say 3 months like that. You have to examine. When the child develops a problem, you treat. That is what the genetic counseling. So I tell you now, you should know what is hereditary pattern, what is non-hereditary pattern by clinical examinations. How do you know clinical examination? Unilateral solitary tumor is there. It is non-hereditary. Unilateral, multiple, bilateral, trilateral, whatever thing is there, these are all hereditary patterns. The unilateral solitary child, suppose the child has improved, the child has been treated, has improved. The chance of his children getting chance is about 6% or 8%. Bilateral child problem is the hereditary pattern. The chance of giving rise to 48% chance. Never forget, hereditary pattern child can transmit 45, given rise to about 45% chance. Non-hereditary pattern child can give rise to, never forget, a child. Child has been cured. He has become an adult. He is asking for marriage. Your answer is like this. Or to follow? I hope you have understood something about the hereditary patterns. And these are all called the genetic counseling. You are supposed to give to the children, retinoblastoma patients, that too when the patient has been cured. The child has been cured. He has come to you with the advice, for the advice. Same way, father, mother, normal. And they got, unfortunately, one child of retinoblastoma. They will ask you, can I have one more child? You have to correspond, you must tell. You should know as a hereditary pattern, non-hereditary. That you should know this. Non-hereditary pattern, I already told you about the percentages. Never forget, just know percentages. In the examination, you are supposed to tell the chance of developing problem is 1%, 6%. Let them tell in the exams. You cannot, nobody can predict. But once the patient, you always advise, sir, once the child is there, once it is born, is a hereditary pattern and all, better advise proper periodic examination of the child. Once the child develops a problem, you must treat him early detection, give him cure. That's enough. This is what the most important question of as far as this genetic counseling is concerned. Thank you very much. I hope you've understood something. Otherwise, just listen properly. You can easily understand. It's not difficult. Thank you very much.